And doctor, many people hear the words clinical trials. Could you explain what it entails? Because a lot of people don't know and may shy away from it when indeed it could be a great resource.
Absolutely. And I think dispelling misconceptions or uncertainty around clinical trials is critical. So a clinical trial is essentially a type of research that is heavily regulated by the government, by the FDA, by institutional review boards that are there to try to protect the rights and welfare of subjects in order to determine if an experimental or an investigational treatment, as we call it, performs to a certain degree or level that we feel is clinically acceptable for its use in clinic, and whether or not these investigational treatments are better than what we would consider our gold standard or standard of care treatments that are currently available in the clinic. And so often a clinical trial will have the experimental treatment in one arm, and the patients may be assigned to that treatment, or they may be assigned to what we call a comparator or control arm that will have an active standard of care treatment, right? And so it's critical for patients to understand that for cancer trials, it's extremely rare and almost not done nowadays that a patient would get a placebo or a complete sham treatment that would not work for their cancer. Often they are either given the option of being assigned to a standard treatment, which they would get at their regular clinic or provider anyways, or a chance to get assigned to a novel or a new treatment to see if it works better for their cancer. And these kind of experiments and data are critical for us as doctors to be able to generate the kind of evidence and data we need in order to recommend a specific treatment.
In terms of just how important early detection is, and start talking about mammograms and things of that nature. But can you tell me the differences in detail between those two?
So in terms of the differences between non-invasive and invasive cancers, we classify them based on how far the tumor cells have gotten outside of the milk ducts where the majority of breast cancers start. So many of these cells from a ductal cancer will begin to multiply and grow within the milk ducts, but they take some time potentially to learn how to break through and invade into the breast tissue and beyond. So that part is non-invasive. Whereas then when they become invasive, it means that those cells have learned how to basically break out of the milk ducts and invade into the adjacent tissues and beyond. And that's known as invasive ductal cancer, right? And that, as the video explained, is the predominant type of breast cancer that we see. The next most common type that the video alluded to is called lobular cancer, which forms more so in the milk-producing tissue within the breast, not necessarily confined to the ducts. And this type of breast cancer does behave somewhat differently to ductal cancer in terms of the types of therapies that it responds to or how it infiltrates the breast. And so often we do have to take that into account as medical oncologists when we're treating a patient because that does have some implications regarding the types of treatment that we would recommend for that patient with a lobular cancer versus a ductal cancer. However, for the most part, the two types of breast cancer, ductal and lobular, are treated fairly similarly, stage for stage.
And is there a connection between alcohol use and breast cancer? And I'm so glad Kathy is asking that because I've always wondered that as well. I love my little vino, my little glass of red wine almost every day. And, I always hear people say, don't do that. But is there a connection, doctor?
Olga, Kathy, unfortunately, not that I want to be a party pooper, but there does appear to be a connection to alcohol intake and breast cancer as a potential lifestyle or modifiable risk factor. I wouldn't say it's the strongest. However, epidemiological studies do indicate that there does appear to be an increased risk of a woman's lifetime breast cancer risk if she is a regular, drinker. And typically when we look at what does that look like in terms of how much is, going to increase that risk. And I get this question all the time from my patients. So it's something that we often will have to go over with them regarding diet and lifestyle modifications. So a woman who is just an occasional drinker, social drinker, a drink here or there with a meal with friends, that is not likely going to cause a significant increase in a woman's lifetime risk of getting breast cancer. However, if a woman is accustomed to drinking, a drink every day, so we're talking about somebody who's regular, has 2 or more drinks, say a day regularly, that can cause an increase in the woman's risk of getting breast cancer from epidemiologic studies. And when we say a drink, it's usually a glass of wine, a serving of beer, or like say a shot of like harder liquor or distilled spirits. And so that's probably the most important message, is that regular intake of alcohol on an ongoing basis over time can increase the risk, but occasional social drinking does not likely lead to a significant increase in risk.
All right, Kathy, so you and I just heard it. Maybe we have to make some adjustments here. All right, doctor, we got about 5 minutes, and I want to get to a few more things real quick if we can, especially the importance of mammograms, ultrasounds. I know many women sometimes have to get both. For example, me, I have very, 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 very dense breasts. So I have to get my mammogram and then an ultrasound. But how important is it? When should we start? Is it a yearly thing? Just tell us what the protocol is today.
Yeah, so there has been some confusion about this topic over the past few years due to some of the various guidelines that have been released by different bodies. The U.S. Preventative Task Force Service had issued some guidelines saying that women could consider starting screening at age 50. And the evidence, according to the task force, had suggested that mammograms every other year, starting age 50, were sufficient. However, many of the cancer specialty societies and, frankly, most of the oncology doctors and radiology doctors do not necessarily advise that. We have been still sticking with much of the traditional guidance on starting mammography and screening at age 40 for a woman of average risk, and that we still recommend annual screening. So mammography, and if additional imaging like ultrasound or MRI for very dense breasts is required, at the discretion of the physicians and the patient who is undergoing screening, that may be added in. But we still go by that annual mammography for average risk women starting at age 40.
Fantastic. And doctor, we have about a couple minutes left, and I want to get a viewer question in real quick from Sherry, because we love our viewers. And she writes, I'm in my early 30s and just did one of those DNA kits. It said I was 99% Jewish. Would a genetic doctor be able to determine my risk of developing breast cancer? And there's the question right there. Doctor, what are your thoughts to Sherry's question?
This question is very salient for her because she has obtained testing and information, potentially, from my understanding, using the kits that are sold to the public, such as 23andMe and Ancestry and other vendors that have this type of technology available to the public for them to learn more about potentially their heritage background, but also potentially about some health concerns. And one thing that we as physicians and oncologists caution the public on is that these tests do not replace our clinical assays or tests that are used by our genetics counselors in order to look for hereditary causes of breast cancer. These assays are specifically designed in order to provide more accuracy around the diagnosis and detecting mutations that can increase a woman's risk of developing a breast cancer. And also that should be paired up with genetic counseling so that a woman can be properly advised specifically as to her risk of getting a breast cancer from a specific mutation. So using those type of readily available tests that are ordered by the public, I would not advise going off of that information. I would check with your doctors about whether or not you should be tested using a clinical grade genetic assay to see if you have a hereditary cause of breast cancer, specifically if it's in your family. That's an important part that we advise patients about as well.